Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Good afternoon and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders, presented by CNS Healthcare. I am your host, Nancy Gandolo, Chief Marketing and Outreach Officer. We want everyone to know your mental health matters and it is okay to not be okay. Before we begin today, I'd like to announce our winner from last week's survey. Kelly, congratulations and thank you for watching. We will be emailing you your gift card shortly. Joining us today is Kirsten Gutherman, Suicide Prevention Team Lead at CNS Healthcare. She will be talking about reducing access to lethal means and suicide prevention. Kirsten, please tell us a little bit about yourself and then let's dive right into this important topic.
Hello, everyone. As Nancy said, I am Kirsten Gutherman. I'm the Suicide Prevention Program Lead here at CNS Healthcare. I have my master's in social work and I have an extensive background in working with trauma, working in community mental health, and I'm very excited in this position to be working on such an important topic in our community. Mental health stigma has reduced a lot, but I think that suicide stigma is still really present, and so I am so happy for any chance to have a conversation like this.
Can you talk about what it means to reduce access to lethal means and how it can help prevent suicide?
Yes. So generally when we're looking at suicide prevention, a lot of things are saying, it's okay to not be okay, reach out if you need help, check on your friends, things that work on individual interventions, but things like reducing access to lethal means looks at it from an environmental perspective. So I will explain what that means to you guys. So with universal screening, we're identifying risk. We're trying to get people to have help, but sometimes people don't have competent care. So what that means is, like you may have noticed at your primary care physician, they may have started screening for suicide. They may have asked you questions like, have you ever wished you were dead or wished you could go to sleep and not wake up? Have you ever thought of how you might do this? Those are the kind of screenings that we use in our program as well. But you have to do it in an empathetic and culturally competent way. So if you ask it the way that I just did, you'll get a very different response than if your doctor says, you're not thinking of doing anything crazy, right? So reducing access to lethal means looks at taking away the method. So rather than taking away the thoughts or learning how to deal with suicidal thoughts, it's taking away the method. And what that means primarily in the United States is increasing safety regarding firearms. This is a very touchy subject, so I just want to put it out there that I understand that this is a really hard topic, but it is something that really needs to be discussed, because the more we avoid conversations, the more stigma and shame is involved and the less we feel able to talk to each other about it. And suicide prevention is all about having the conversation. So in the United States, more than half of the suicide deaths are by gunshot wound, and 90% of people who intentionally shoot themselves or accidentally shoot themselves, any self-inflicted gunshot wound, 90% die as a result. So when we're looking at reducing access to lethal means, we're looking at any type of method that someone might want to use, and I'll go over some of those. But in the United States, primarily, we're looking at how do we add safety when we're thinking about firearms. As an example, in other countries, there are other means that account for most of their suicide deaths. In Britain, most of the suicide deaths before the 1960s were caused by inhaling carbon monoxide, generally through like turning on your stove. Legislation in the 1960s removed carbon monoxide from domestic gas, and suicide deaths reduced by almost 30%. Suicide deaths by other methods did not change, so the reduction can be explained by the removal of carbon monoxide. And since there was no other increase in other methods, we can surmise that people who would have died by carbon monoxide poison did not switch to another method. And we have a lot of research and a lot of data that shows things like that. So when we're thinking of suicide from a public health model, imagine an upside down triangle. And up at the top, we have elimination. And then getting smaller, we have substitution, engineering controls, administrative controls, and personal protective equipment. And we kind of go from the top that elimination is the most effective, and then down at the bottom of the pyramid are these administrative controls and then the PPE. So the things that work the most are taking something away entirely. But when we're talking about reducing access to lethal means, we want to talk about it as adding safety. So we're not trying to remove somebody's rights. We're not trying to say that people can't have things. We want to add safety.
So could you tell us specifically, as it relates to firearms, how you could put some controls in place to make it less accessible for lethal means?
Of course. So if we can't go for elimination, then we want to go down on the pyramid. So things like substitution and engineering controls, administrative controls. So with these engineering controls and administrative controls, that's things like having policies that say that your firearm has to be in a safe, that adding gun locks, and keeping your ammunition stored elsewhere. There's research that shows that things like this are effective. So the DC Firearms Control Regulation Act of 1976 stated that people must maintain registration to own a firearm, and that firearms needed to be stored either locked up or disassembled. Because of this law, firearm suicides reduced by 23%, and rates did not change in Maryland or Virginia nearby. So you can see that it was this policy that was implemented that caused this 23% reduction. In Israel, 93% of their suicide deaths in the military were caused by firearms. So the government issued a policy that individuals could not take their government-issued firearms home over the weekend, because most of the firearms suicide deaths were happening over the weekends. And suicide deaths reduced by 40%. So they didn't switch to another method. They didn't acquire a gun a different way. When that was taken away, they didn't do it on a different day. Just they couldn't have their firearm home with them on the weekend, and it reduced by 40%. Okay, so research shows that having a firearm in the home increases the possibility that someone within the home will die by suicide, even if no one in the home has an identified mental health issue. Suicide among children is much higher in homes with a firearm, but the difference between homes with a firearm and without a firearm is reduced if the firearm is stored safely. And research defines this as if the firearm is locked up, if it's unloaded, or if the ammunition is stored elsewhere. So they make gun locks. I actually have one right here to show you. They just go like this. It looks like a tiny bike lock, and it goes through the gun so that it cannot be loaded. They also make trigger locks, but the locks that are like this are more effective and easier to use than the trigger locks. And you can often pick them up from places like the police station. I highly recommend looking up an organization called Project Child Safe. They're involved in giving out these free gun locks, so there's no barrier to getting this safety to add. So if the gun is locked up, if it's unloaded, if ammunition is stored elsewhere, if you have an ammunition locker and that's in an entirely different place, any one of these strategies has shown to reduce suicide deaths in children by over 50%. And we see this pattern because we know from research that people can have suicidal thoughts over a very long period of time, but the period of time between when someone decides to make an attempt and when they make an attempt is only 3 to 5 minutes. So when we're looking at keeping people safe, we want to make it take longer than 3 to 5 minutes for them to make the attempt. When someone is in distress, their cognitive skills are down, they might not remember their safety plan, they may not have a safety plan, they may not know who to reach out to, then things like adding safety or removing the lethal means will keep them safe in that 3 to 5 minutes because they don't have a way of acting on it. If we're talking about things like just keeping your gun in the safe, because you may be thinking, well, if my gun is in a safe and I'm having these thoughts, then I could just go unlock my safe. But any of these barriers make it take longer, make you think more about it. But if you have that thought, if you are in distress and you have to do something like going into a safe, removing a gun lock, maybe you put the keys somewhere else. So now you have to go in the basement to go get the keys and you unlock the gun, but your ammunition is in your garage. So then you have to go unlock that. It makes it take you longer. It makes you think about it more. It gets rid of these spontaneous suicide deaths, which is very often what we see.
Transitioning, we know that LGBTQIA plus youth are 4 times more likely to attempt suicide as their side gender counterparts. So what can people in the community do to better support the LGBTQIA plus community?
So again, we look at culturally competent care. So if an individual who is part of the LGBT community goes to a therapist, but the therapist doesn't understand gender affirming care, or if it's one of the states where they're not allowed to give gender affirming care to children, we see these suicides because we're not able to affirm a child's identity. Even if you don't understand someone's identity, you can accept and love them. So we see things like very high homeless rates of trans individuals because people being kicked out of their homes. We see higher rates of domestic violence, especially in bisexual women. We see higher rates of sexual assault, especially against bisexual women. And so all of these increased risk factors, we need to focus on as a society to reduce them overall, but individually looking at being affirming of someone's identity, letting them know that you are there for them, and finding a provider that knows what they're talking about, that can help someone through their coming out process or through if they've lost family members due to coming out. Suicide rates in the transgender population, especially among children, go down when they're allowed to have gender affirming healthcare, when they're allowed to get things like binders or hormone blockers, when they are able to be themselves, those suicide rates go down dramatically.
Wonderful. If you're just joining us, this is Bright Spot, your community connection to wellness, presented by CNS Healthcare. Today, we're speaking with Kirsten Gutherman about reducing access to lethal means and suicide prevention. June is National Men's Health Month. It is Pride Month, and it's National Gun Violence Awareness Month. And we have addressed gun violence. We have addressed some pride issues. Now I'd like to talk about men's health. So can you talk about the trends we're seeing about men's health during the pandemic? And also, are men more likely to attempt or complete suicide than women?
It's easier to identify depression by this sadness. That's kind of what we hear about a lot. But with men, a lot of times mental health issues are expressed through other things such as anger. And we might not look at someone who is angry or who is involved in intimate partner violence as someone who might be at risk for suicide, but they are. And so we need to know what the specific risk factors, just the same way that we know what the signs of a heart attack are in men, but the signs of a heart attack in women are different and they're not as well known. And so with men, we need to know what their specific risk factors are and be targeting that. We also know that men own more firearms. We know that women make more suicide attempts, but men, there are more suicide deaths generally because men choose firearms as their method. This is changing though. The gap is closing because women and children are starting to choose more lethal means. We know that we need to monitor medication. A lot of women and children die by intentional overdose. So we would be putting in controls of who's looking out for their medication. Can someone else hold on to it? Can we switch from one medication to another so that there might not be on something as lethal? But for men, I think it's a lot about we don't let them talk about it enough. We don't talk about it enough. We don't look for the specific signs. There are really great organizations that are doing stuff. I recommend Man Therapy, which their partnership with Michigan and Prism. They're doing some wonderful things. So if there are any men in your life who might, or if yourself, if you'd like to get your head checked out, as they call it on the website, please check out Man Therapy.
Kirsten, one additional question. There's been a lot of information out in the news, or myths, I think, about mental health and gun violence, and those with mental health issues being the largest perpetrators of gun violence. Can you talk about that and kind of some of the myths around that?
Thank you so much, Nancy. That's something that I'm super passionate about, so I would love to answer this question. It is most definitely a myth. People with serious mental illness are much more likely to be the victims of crime than the perpetrators of a crime. So if the only time that we talk about mental health issues is after a tragedy, after gun violence occurs, that just adds to the stigma of mental health. We are then linking and saying that people with mental health issues, the only time we want to talk about that is based on this violence. But that's not true. And you need to question your motives, because if you're having this conversation only in response to gun violence, you're trying to say that there's some other cause of the gun violence, like they must have had a mental health issue, not addressing the root cause of the gun violence. Rather than talking about gun control, because that can scare a lot of people off, we want to talk about adding safety. However, things like waiting periods, I think waiting periods would be very effective. So if there was a mandatory waiting period, it's the same thing as reducing access to lethal means, where we make it take longer. They can't act impulsively.
Suicide Prevention Team has an event coming up in August. Can you tell our viewers more about it and how to register to attend?
Yes, we are having an event. We are having a professional suicide prevention event revolving around reducing access to lethal means. People who can sign up for this include clinicians, people in the mental health field, but also people who are community stakeholders. This could be librarians, it could be pastors, anyone who has a vested interest in helping their community. You can register for this in the link that'll be on here or down below, and we hope to see you there. It will be at a very nice lunch place, and you'll get to hear a speaker from University of Michigan who is part of their firearm injury prevention department. We're very excited to have her. We will also be at other events throughout the summer, which we will have on our social media.
What are some tips that you could give our viewers at home and things to look for, I guess, so to prevent a crisis from happening?
So one of the most important things is knowing what the method is. That's what we've been talking about the whole time. How can we remove this method? But that doesn't remove the importance of the universal screening and the encouraging people to get help. So if you're noticing the things that are kind of standard, like giving away your possessions, someone writing a will or starting to talk about how they would like their funeral to be, things like being more withdrawn. But you want to also look at things like if there's someone in your life who's been going through a deep depression and they suddenly seem very happy, if they're saying that things are better, if there's this sudden change, we want to be concerned about that, because improving mental health issues, recovering from things, it's a very gradual process. And these sudden snap changes could be because someone has decided to end their life. And so they may not be feeling this depression anymore because they know that it's going to end soon. And so we really want to be aware of that. That's also why we see suicide rates increase in the spring and summer. Some people would think that maybe with seasonal affective disorder that most suicides are in the fall or the winter, but the spring and summer are really, really danger zones. May and June have the most suicide deaths. So we also want to be looking out for people who we know have made attempts in the past. If someone has made an attempt in the past, they can recover and never make an attempt again. But we know that having attempt in the past increases the likelihood that another attempt will occur. So if they become in crisis again, if there's a sudden breakup, if they're having housing instability, they could jump back to that escape. So we want to be aware of those things as well.
Thank you again, Kirsten, for joining us today. Some wonderful information for all of us to take out into the world and help keep it a safer place. And we hope you will mark your calendars and continue to join us the second Monday of each month to discuss feelings, struggles, and finding one's way. If you have a topic you'd like to hear us discuss, please drop it in the chat or comment on this video. Finally, we select one winner for a $25 Amazon gift card and announce it next week on Bright Spot. So please take the time to fill out our 2-question survey that is linked in the chat now. Remember to be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Have a great week.